Blackheads are one of the most common, and most frustrating, forms of acne. They can show up at any age, in any climate, and on almost any skin type, but they are especially common on the nose, inner cheeks, forehead, and chin. Before we get into a prevention plan, a quick note: this is general educational guidance, not a personal medical diagnosis. If you have severe acne, painful breakouts, scarring, or a skin condition that's worsening quickly, it's worth seeing a licensed dermatologist for individualized care. Now, what exactly is a blackhead? A blackhead is an open come-done. Inside each pore is a hair follicle and a sebaceous gland that produces sebum, oil. When dead skin cells and sebum build up, they can form a plug. If the top of that plug is open to the air, the surface oxidizes and turns dark. This is why blackheads look black. The darkness is not dirt, and scrubbing harder usually makes things worse, not better. Prevention is about reducing that buildup, keeping skin barrier healthy, and using the right ingredients consistently. The most important concept in preventing blackheads is balancing two priorities at the same time, keeping pores clear while protecting the skin barrier. Many people overfocus on degreasing the skin and end up stripping it, which triggers irritation and can increase oiliness as the skin tries to compensate. Blackhead prevention works best when it's gentle, regular, and long-term. Think in weeks and months, not overnight fixes. Let's start with daily cleansing, because this is the foundation. Cleanse your face twice a day, morning and night, with a mild, fragrance-light cleanser that doesn't leave your skin squeaky tight. If you have oily or acne-prone skin, a cleanser containing salicylic acid can be helpful, but you don't need strong acids in both a cleanser and leave-on product right away. If your skin is sensitive, start with a plain gentle cleanser and add actives later. At night, cleansing matters most because you're removing sunscreen, pollution, sweat, and makeup. If you wear makeup or heavy sunscreen, consider a two-step cleanse: first a makeup-removing balm or micellar water, then a gentle face wash. The goal is thorough removal without harsh rubbing. After cleansing, the next key is using a pore-clearing ingredient that targets the glue that holds dead cells together and helps clear oil within the pore. The gold standard for blackheads is salicylic acid, also known as beta-hydroxy acid, BHA. Salicylic acid is oil-soluble, meaning it can penetrate into the pore lining more effectively than many other acids. Used correctly, it helps prevent the buildup that forms blackheads and can also improve skin texture over time. A common beginner approach is a leave-on salicylic acid product used 2 to 3 nights per week, then slowly increased if your skin tolerates it. If you jump straight into daily use, you may get dryness, peeling, or irritation, especially around the nose and mouth corners. Irritation can trigger more breakouts, so gradual is smarter than aggressive. Another cornerstone for long-term prevention is a retinoid. Retinoids normalize how skin cells shed and help prevent microplugs from forming in the first place. Over-the-counter adapalene is a common option in some countries. In other places you may need prescription products. Retinoids are not an instant fix, but they are one of the most evidence-supported tools we have for comedonal acne, blackheads and whiteheads. If you choose to use a retinoid, start low and slow, a pea-sized amount for the entire face, applied to completely dry skin at night, 2 to 3 times per week for the first few weeks. Then gradually increase frequency as tolerated. Many people use the moisturizer sandwich technique: moisturizer first, retinoid second, moisturizer again, to reduce irritation. Expect some adjustment. Mild dryness or flaking can happen early on, but severe burning, swelling, or persistent redness is a sign you need to stop and reassess. And an important safety note: if you are pregnant, trying to become pregnant, or breastfeeding, do not use retinoids unless your clinician explicitly approves, because these products are generally avoided in pregnancy. Because prevention is not only about unclogging pores but also about keeping the barrier calm, moisturizer is not optional, even for oily skin. When skin is dehydrated, it can become inflamed and reactive, which can worsen acne and make pores look more obvious. Choose a lightweight, non-comedogenic moisturizer. Look for ingredients like glycerin, hyaluronic acid, ceramides, and niacinamide. Niacinamide is especially helpful for many acne-prone patients because it can support the barrier, reduce inflammation, and help regulate oil production over time. If you're using salicylic acid or a retinoid, moisturizer becomes even more important to keep your routine sustainable. Sunscreen is another essential step that people often overlook when their main goal is blackhead prevention. UV exposure can thicken the outer layer of skin and contribute to uneven shedding. It also worsens post-acne marks and makes skin more prone to irritation when you use active ingredients. A daily broad-spectrum sunscreen, ideally SPF 30 or higher, protects the skin while you're doing preventive treatment. If you hate sunscreen because it feels greasy, try newer lightweight gel or fluid formulas labeled non-comedogenic. Sunscreen should be applied every morning, and reapplied if you're outdoors for extended periods. Now let's build a simple, realistic routine that you can stick to. In the morning, cleanse gently or simply rinse with water if your skin is very dry or sensitive. Then apply a lightweight moisturizer if needed, and finish with sunscreen. If you want an optional morning active, niacinamide is often a gentle choice. In the evening, cleanse thoroughly. Then choose either salicylic acid or a retinoid depending on your plan. Many people alternate nights to reduce irritation. Finish with moisturizer. This cleanse, treat, moisturize structure sounds basic, but it's powerful when done consistently. A common mistake is stacking too many actives at once: salicylic acid, retinoid, strong vitamin C, multiple exfoliating toners, scrubs, masks, all in the same week. That approach often creates inflammation and barrier damage, which can worsen texture and breakouts. If your goal is blackhead prevention, fewer products used consistently almost always beats a long list used inconsistently. Let's talk about exfoliation, because blackheads often make people reach for rough scrubs. Physical scrubs can irritate the pore opening and cause microinflammation, especially if the granules are harsh or if you scrub vigorously. In general, chemical exfoliation with salicylic acid is safer and more effective for blackheads than scrubbing. If you enjoy physical exfoliation, keep it very gentle, infrequent, and avoid gritty products that feel sharp. Your skin should never feel raw afterward. Pore strips are another popular quick fix. They can remove some surface debris and fine hairs temporarily, but they don't prevent blackheads from forming and can irritate the skin barrier, especially around the nose. Think of them as a short-term cosmetic option at best, not a preventive strategy. Steaming the face is similar. Warmth can soften oil temporarily, but steaming can also trigger redness and sensitivity. If you like warm compresses, keep them brief and gentle, and don't rely on steam as the core of your routine. Clay masks can help absorb surface oil and give a temporary smoother look, which some people find satisfying. They can be used once a week if your skin tolerates them, but they should not replace a consistent leave-on active like salicylic acid or a retinoid. If you use clay masks, follow with moisturizer to prevent dryness. Blackhead prevention also depends on your product ecosystem, everything that touches your skin. Hair products are a surprisingly common culprit, especially heavy pomades, oils, and leave-in conditioners that sit on the forehead and temples. If you notice blackheads along the hairline or forehead, consider switching to lighter hair products and rinsing thoroughly. Similarly, makeup and skincare products labeled non-comedogenic can be helpful, but labels aren't perfect. If a product consistently seems to worsen congestion, stop it for a few weeks and see if things improve. When introducing new products, change one variable at a time so you can identify what helps or harms. Mechanical friction can also contribute to clogged pores. Tight masks, helmet straps, chin guards, frequent face touching, or resting your chin on your hands can all aggravate congestion. If you work out frequently, cleanse soon after heavy sweating, and avoid leaving sweaty gear or occlusive fabrics against the skin for long periods. Also clean items that touch your face often: phone screens, pillowcases, makeup brushes, and reusable masks. You don't need to sterilize your life, but regular cleaning reduces pore clogging residue and bacteria. Diet is a sensitive topic because people want a single cause. Blackheads are primarily driven by oil, cell turnover, and genetics, but lifestyle can influence acne for some individuals. The most consistent dietary associations in research relate to high glycemic load diets and, in some people, certain dairy intake. This does not mean everyone needs to cut out dairy or sugar completely. A practical approach is to aim for balanced meals with fiber, protein, and healthy fats, and limit frequent spikes of sugary foods and refined carbs. If you suspect a specific trigger, try a structured, time-limited experiment, such as reducing high glycemic snacks for a few weeks, while keeping everything else stable. Extreme restriction is rarely necessary and can be unhealthy, so focus on patterns, not perfection. Stress and sleep also matter because they influence hormones and inflammation. Chronic stress can increase cortisol, which may worsen oiliness and breakouts in some people. Prioritize consistent sleep, stress management, and movement, not because they cure blackheads, but because they support overall skin resilience and reduce inflammatory flares. Now let's address the temptation to extract blackheads at home. Picking and squeezing can damage the pore wall, cause inflammation, and increase the risk of lingering marks. Even if you win in the moment, you can end up with larger-looking pores, redness, or post-inflammatory hyperpigmentation afterward. If you feel compelled to extract, it's better to shift your routine toward prevention and, if needed, seek professional help. In a clinical setting, trained extractions and treatments can be performed more safely with sterile technique and appropriate aftercare. At-home come-done tools can easily cause injury, so I generally do not recommend them for prevention content, especially for broad audiences. If you do decide to pursue professional options, a dermatologist or licensed clinician may offer come-done extraction, topical prescriptions, chemical peels, such as salicylic, glycolic, or combination peels, or other procedures depending on your skin type and sensitivity. These can be helpful additions, but they still work best when paired with a consistent at-home routine. Procedures alone are rarely enough to prevent blackheads long-term if daily habits don't support poor health. Let's talk about timelines and expectations, because this is where many people give up too early. Blackhead prevention is not a one-week project. Skin cell turnover cycles take time. With salicylic acid, some people notice smoother texture within a couple of weeks, but more meaningful improvement often takes 6 to 12 weeks. With retinoids, it's common to need 8 to 12 weeks to see clear come-down reduction, and sometimes longer. Early in treatment, you may notice mild dryness, or even a temporary flare as microcomedones surface. This doesn't mean it's failing. The key is steady, tolerable progress, not aggressive irritation. If your skin becomes irritated, pull back and simplify. Use a gentle cleanser, moisturizer, and sunscreen for a week or two, then reintroduce active slowly. This reset approach often prevents people from abandoning treatment altogether. Remember, the best routine is the one you can maintain. Different skin types need different pacing. If you have oily, resilient skin, you may tolerate salicylic acid more frequently and build up to a retinoid without much trouble. If you have dry, sensitive, or eczema-prone skin, your barrier needs extra protection. You might use salicylic acid only once or twice weekly and rely more on a retinoid applied carefully, or you may choose gentler alternatives like azelaic acid, which can help with texture and congestion while being relatively well tolerated for many people. Fragrance-free and alcohol-light products can reduce the risk of irritation in sensitive skin. For people with deeper skin tones, one additional prevention goal is reducing unnecessary inflammation, because inflammation can lead to post-inflammatory hyperpigmentation, dark marks that last longer than the original blackhead. That makes gentle routines even more important. Slow, consistent pore prevention plus sunscreen is a powerful combination for both breakouts and marks. Hormonal patterns can also influence blackheads, especially around the jawline and chin in adult women. If blackheads and acne flare cyclically with your menstrual cycle, or if you have other signs of hormonal imbalance, a clinician can discuss options tailored to you. For educational content, it's enough to mention that hormones can influence oil production and that persistent adult acne may benefit from professional evaluation. Now, here are some practical rules of thumb that keep blackheads from coming back. Keep your routine simple and consistent. Avoid harsh scrubs and over-cleansing. Use a pore-targeting active like salicylic acid and/or a retinoid, introduced gradually. Moisturize daily even if you're oily. Wear sunscreen daily. Keep makeup and hair products light and rinse thoroughly. Reduce friction and occlusion on the face when possible. Don't pick or squeeze. And give your skin time, because prevention is a long game. To make this even more actionable for a general audience, imagine your week as a rhythm. Most mornings are gentle: cleanse or rinse, moisturize if needed, sunscreen. Most nights are consistent: cleanse, then either salicylic acid or retinoid depending on your plan, then moisturizer. One night per week can be a support night with no actives, just cleanser and moisturizer, especially if you're prone to dryness. If you want a mask night, that can be the same night as your support night, followed by moisturizer. This structure keeps skin calm and reduces the risk of irritation. Finally, it's important to know when blackheads are not just blackheads. Sometimes people mistake sebaceous filaments, normal, tiny, grayish dots in the pores, especially on the nose, for blackheads. Sebaceous filaments are part of normal pore function and will never disappear permanently. They can look less noticeable with consistent salicylic acid, retinoids, and sunscreen, but chasing a completely poreless nose often leads to overtreatment and irritation. A healthy goal is smoother, clearer-looking skin, not perfect pore invisibility. If you follow this prevention strategy and still see persistent, widespread blackheads after about 3 months of consistent care, or if you're developing painful acne, scarring, or significant emotional distress, it's time to see a dermatologist. There are prescription options and in-office treatments that can make a major difference, and you don't need to struggle alone. Blackheads are common, but they're also manageable.